We've all had conversations with folks, and afterwards we thought, do you know what? That didn't go so well. And, I wish I had said that. I wish I had said this. But we have developed theater for vaccine hesitancy. And what we have been doing is we've been taking scenes of vaccine hesitant patients and the interaction with the providers. And we've been running through them and letting people just view them and just think about how well did that go? And, could we have said something different?
Using self-determination theory and the idea that it's not really facts that are probably going to get most people to change their mind, that it's really like a personal connection, the empathy, so using the pillars of self-determination theory, which are autonomy. So remembering that you want to emphasize that they have a choice, but that you hope they make the choice to get vaccinated. So we're trying to emphasize autonomy, trying to emphasize relatedness. So that idea that human connection and how can we really foster that connection to help people kind of move along that hesitancy pathway towards actually getting vaccinated. And then competence. So if they do have specific concerns that they're worried about, and that we do also address those specific concerns, but really in a way that's connected and providing them the information they need to make this choice.
So our first scenario is a vaccine hesitant patient at a provider appointment. And this could either be in person or telehealth, and it's a regular annual checkup. And we have our vaccine hesitant patient who is being played by Sarah, and that individual, actually, the name is Chris. And then we have our provider who is being played by Michael.
Hey, Chris, how you feeling today?
I'm all right. As all right as anyone can be these days.
Do you feel unwell?
Oh, no, I'm fine. Eat healthy, exercise, all that. Just stressed about this economy.
Okay, well, how about your vaccinations?
Yeah, got my flu shot. I'm all set.
And have you received your COVID-19 vaccine?
No, I don't need that. That's for old and sick people. I'm the healthiest I've ever been.
Well, even young and healthy people are at risk for COVID-19. I recommend that you get vaccinated.
I don't want to put that virus in my body. My immune system is strong.
Well, mRNA or messenger RNA vaccines don't put the virus in your body. It doesn't matter that you have a strong immune system. If you get COVID, you could still get seriously sick or die.
I don't think it's as bad as the media says. My brother got COVID and it was just a bad cold. But some people get the vaccine and get strokes. I'm fine without it.
Well, statistically speaking, you're at far greater risk from COVID-19 than from any of the side effects from the vaccine. In fact, unvaccinated patients are 17 times more likely to get hospitalized.
I'd rather take my chances than have some vaccine change my DNA.
Well, the mRNA vaccine never enters the nucleus of the cell. There's no way that your genetic material could be altered.
And then what? I get sick for a week because of the vaccine? I can't afford to not work for a week. Our business is already struggling as it is. You doctors don't know how it is.
All right, fine. I don't know what else to tell you. Wear a mask, I guess.
Okay, folks. What did you think of that? Thoughts on the interaction? Phyllis, your eyes are saying 1,000 words.
Oh, you got it. It was terrible.
It was horrible.
It was awful.
Can you tell us a little bit more about why it was horrible?
I thought Sarah's really good. She made a good statement. She stated her case. The doctor was terrible. I would have walked out on him. He was just awful. His face, the way he was looking at it was like, you're some kind of a nut. I mean, come on. He had no patience, no empathy, no compassion, no anything. He was using words that really did not. mRNA, who knows what that is? Maybe they don't even know. So it wasn't really clear. It was really high level. And he definitely seemed like, okay, get it or not. He said the words, but there was no feeling behind him. Like, let's get this over. We don't want to do it. Okay. And so yeah. It just wasn't a good interaction. And I definitely don't think it would have changed anybody's mind. I probably wouldn't do it just because he asked.
I think Phyllis summed it up well, but anybody else, any other thoughts?
You didn't get a beginning that gave us a sense that they knew each other or that they were connected or of an opening that kind of conveyed concern or care.
And right at the beginning, she gave him a nice entry. She said, best as can be expected. And that was such a great opportunity to just stop right there and say, what's going on? Tell me what your experience. You know, I know it's hard out there. Is that what you're talking about?
So what we're going to do is we're going to run through this again. And if at any time you think there's an opportunity to change the dialogue as the healthcare provider, so as Michael, I want you to yell stop and tell us how that dialogue could be changed.
Hi, Chris. How you feeling today?
I'm all right as anyone can be these days.
Do you feel unwell?
Oh, no, I'm fine. I eat healthy, exercise, and all that, just stressed about this economy.
Gotcha. Okay. Well, how about your vaccinations?
Stop.
Okay, so I think Nina stopped it first. I thought there was going to be a chorus of stops. So, Nina, tell us why you stopped it.
Well, it's, starting the visit, I thought it would be maybe nice to get some relationship building. And then as we talked about, sort of having him maybe kind of veer off a little more into asking or doing some validating, like, yeah, times are really tough for a lot of people. Can you tell me more about what's been going on for you, or something that allows the patient to talk more about what's going on in their life?
Okay, so Nina, what we're going to ask you to do is we're going to ask you to assume the role of the healthcare provider. Okay. And so you're going to replace Michael, and you can have this conversation with Chris and totally off script, see how it goes. So remembering that the ultimate outcome here is to address the vaccine hesitancy.
Hi, Chris. It's so nice to see you today. How are you doing?
I'm okay, I guess, as okay as anybody can be right now.
Yeah, I hear you. I think it's been a really tough time for a lot of folks. What's been going on for you lately?
Our business is just suffering,
Yeah. Remind me what you do for your business. I'm forgetting.
We have a family restaurant, and it's just hard to get people to work these days. So I'm pulling a lot of extra shifts.
That must be really exhausting. That's really tough. Yeah. Are there any things about your health that you want to make sure we touch base about today?
No, I think just check up, and everything, make sure it's all working good. I'm exercising, I'm eating right, I'm in pretty good shape.
Good. Okay, great. Do you feel like you have the support you need emotionally right now? Have you been checking in with people and talking about the things you're going through at the restaurant?
I mean, I just sort of figure everybody's in a tough time. I don't know that would help.
Okay. Well, we do have resources here if you think that would be helpful. And it's always good to reach out to friends and talk when you're having a hard time, because people are in different places right now about everything.
Yeah, that's a good point. Maybe I should do that. Lighten the load a little.
Yeah. One thing I've been checking in with everybody about, especially people who work in jobs where they're interacting with a lot of people right now, is just seeing if they've been able to get their COVID vaccine. Is that something you've thought about or have already done?
Nah, I mean, I'm not over 65. I don't have, high blood pressure. I'm okay.
Yeah, sure. That's great. And you're right that people who are older and have other health conditions definitely are at higher risk for getting really sick with COVID. But I actually worry about everybody right now. Can I ask kind of why you haven't gotten it or what you've been thinking about?
I don't know. I don't want it to get in my body and change my DNA. I don't want it to mess with me.
Yeah. I'm curious, where have you been getting your information from? Or is there anything I can help share with you in terms of kind of the information I have about the vaccine?
I mean, it just seems like everybody I talk to is like, COVID's not a big deal. You just get a cold and the vaccine can make you sick for like days. I can't miss work for days. Who's going to run the place?
Yeah, I hear you. I think there's a lot of people are really nervous because it feels like a new thing. And it feels like we maybe don't have all the information we need, but is it okay if I share with you some of the information I have about the vaccine?
Yeah. What do you have?
Yeah. So there's actually really good data out there that it's safe. And the vast majority of people actually don't get sick from the vaccine. And we know you actually cannot get COVID itself from the vaccine. That's impossible the way that it's been developed.
I thought they put the thing in you so your body learns how to, fight it.
Yeah, that's a really common thing that people are sometimes confused about. The way vaccines are developed, they're all a little bit different, but they basically kind of replicate, or they create a copy, kind of a tiny little piece of the virus that kind of helps your body say, oh, I have to react to that. If I get sick, I'll already have seen it before, but it's not the virus itself. So it's not actually putting the virus inside you. It's sort of a tiny little piece of it that gets copied. It's not something that can get you sick.
Oh, I didn't know that.
Yeah. So you can't get the virus from it. And I will say, after the second dose of the vaccine, some people do feel kind of exhausted and out of it for 24, like a day or two, 24 to 48 hours. But the vast majority of people are totally back to themselves right after that, able to get to work and everything. Some people have to miss a day of work, but not everybody.
Did you get it?
Oh, let's stop the performance and give Nina a round of applause. Okay, Nina, do you think you accomplished what you set out to do?
Do I think I accomplished what I set out to do? I think we were able to have a non-combative conversation about it, and they were willing to kind of hear what I had to say. I feel like I got a little nervous and jumbled about explaining vaccines, but I think we were able to have a friendly conversation about it.
Good. And Chris, how did you feel with the conversation?
I was interested to keep having it. I had more questions, and I felt like I was hearing some different things from her than I had heard from some of the people in my community.
Okay. Anybody else, any thoughts on what Nina accomplished?
I think that the way that you bridged and you started by addressing how Chris is doing as a whole and seeing what's been going on with Chris, I think that was really good.
Good. Anybody else, any thoughts?
Well, it was a model interview. I thought Nia really did an outstanding job with it, and with their empathy all over the place, and that was really the key to it. The only thing I might add in it was that at some point in the line, the emphasis of acknowledging that this is her decision to make.
The other thing I would characterize about what you did, Nina, is curiosity. You were asking questions, you were interested, and you hadn't started to tell. Like, I was quite sure you were going to get to a clear recommendation, but you gave her all that time to help you understand her perspective and what she needed and what her concerns are. And you asked permission to provide information, which, I mean, big golden rule of MI, of course. But it just totally changes the feeling of, what is this doctor going to do to me here? Are they going to lecture, or are they going to inquire? Is very different.
And, Nina, you mentioned feeling a little nervous about getting into the intricacies of explaining the vaccine. And that's something that we have heard from other medical professionals, that they may know it, but they may not feel confident in how to summarize it in a 1 or 2 sentence way organically in a conversation. And that's also one of the reasons why we try to give these opportunities to practice, so that we have our own authentic answers available to us in those moments.
I'm also thinking, I can spend my entire visit, 20 minutes, talking with her about this. How am I going to do this? And at the end of the time, what am I going to do? She's here for a physical or checkup. I'm sort of thinking about time management too. So both of those things are making me dread how this interview is going to go.
Okay, that's so funny. I don't feel dread at all if it's a patient I know. If it's a patient I don't know, I feel a little more hesitation. Like, oh boy, there's no reason in the world for them to trust me today.